Hey guys, welcome back. You know, we've been talking with Dr. Wilhelm about the Telestroke program that is now in place at Providence Hood River Memorial Hospital. But now we're going to just switch gears slightly and talk to nurse Jane Burke about some of the symptoms of a stroke and what that actually looks like. So, first of all, welcome.
Great. It's lovely to be here.
Well, we appreciate it. So let's
right.
talk about that. What are some of the symptoms that people go through that are having a stroke?
Well, people who are having a stroke can have a variety of different symptoms, but one of the acronyms that's been developed to kind of help both you, if you have those symptoms, or your friends or family, if they see you, is called ACT FAST. And FAST is the acronym, and it means that one of the key symptoms we sometimes see is a facial droop. So if you have somebody smile and one side of their face kind of droops or doesn't follow the natural smile, that might be a symptom or a signal that there might be a stroke. Also, another thing they have people do is raise both hands. And if you're having a stroke, you may not be able to retain your hand. One hand may drift down, and that would also be a very strong sign of a possible stroke. The other thing is to have, sometimes what it manifests as is people not being able to articulate their speech clearly. So you might have ask somebody a question to say, "Tell me your name," and they may not be able to repeat a simple sentence, or they might say, "Well, and you know they're trying, but they just can't get it out," and that's different from what they've ever been able to do in the past. There are some other symptoms that, and then the other thing that is time. Time is brain, and so you want to be, the fast is check the face, check the arms, check to see if they can speak, and then call 911.
Okay.
Because time is brain tissue, and we really want you in the system quickly. There are some other things that we often react to when they come into the hospital, is to make sure that it might not be a stroke. And that is sudden confusion, sudden weakness or inability to use like one leg over the other, profound dizziness, a headache for no reason. You know, all of a sudden you're walking along, you're having a great day, and suddenly you have a blinding headache. And you didn't fall, you didn't hit your head, and those are things that we want to really evaluate quickly to make sure that you're not having a bleeding stroke or a bleed in the brain, or having a blood clot in the brain, which affects the ability of the brain to get blood flow to all the areas of the brain. And that's kind of what our two kinds of stroke are. One, the rupture of a vessel in the brain, or one, there's a plaque or a blood clot in an artery or a little part of the brain that it's just not getting blood flow to the rest of the tissues. An analogy I think people are more familiar with is a heart attack.
Right.
When you have a heart attack, you have plaque or a blood clot affecting the ability of blood to flow to a part of the heart. A symptom for that is you have this chest pain or pressure or nausea. And I think people are very familiar with the heart attack and less familiar with like brain attack. And we'd like to elevate the knowledge that people have about worrying about the brain symptoms, because just like a heart attack, we only have a little bit of time from the time those symptoms start to when we reach the end of our time, when we can actually think about giving a clot-busting agent, TPA, to be able to relieve that clot, to restore blood flow to the brain areas, to decrease the symptoms and return people to the same function they had before this event started.
Okay.
So that's why we say time is brain. And it used to be we had a 3-hour window, and now they've found that for most population age groups, we can increase that area to 4.5 hours, so we can do more now than we could do before.
Okay.
And that's kind of our whole ramp up with our Telestroke program, is to say we want to do more, we want to decrease the time, We want to be sure and give the drug if it's indicated, and we want to get the specialist to the patient to help us make that decision so we know we're doing the best thing in the greatest amount of time. Many times, if your loved one was sitting watching TV, say, and something happened, an hour might have gone by before you even noticed that he now can't say a simple sentence, or that he can't smile equally, so you lose a little time there.
Yeah, because a stroke isn't necessarily painful.
No, the individual himself may not be the one that quickly recognizes that something's wrong, because they might be confused, and they may not know they're confused.
Okay, okay,
yeah. So those are the kinds of things that if the public's more aware, and we can kind of increase awareness along with increasing our timeliness to treatment, that we can really reduce the amount of impact of stroke in Oregon.
Yeah, yeah. So. Well, very good. All right, well, we're going to have to leave it there.
All right.
Thank you so much.
All right, it was great being here.
It's a pleasure meeting you.
And
it's great work you guys are doing, and I'm excited for you. And it's reassuring just knowing, you know, that there's something available for folks that you know, may have a stroke.
Absolutely.
God forbid, but may, you know.
Yeah,
so.
It's great for us to have this new technology so that we feel like we're really on top of the best that we can do.
Yes. All right. Well, again, thank you so much for your time. Really appreciate it. You guys, thank you for watching, and we will see you next time right here on Localite. John Compton here saying thanks again for watching. And remember, if you've got a guest idea, let us know. Just visit localite.com.